an honor to be here this evening. I hope that you can walk away this evening knowing exactly what you need to do to give yourself the best chance of cure or for living as long and as well as possible. And so I want to provide you with an integrated and practical approach to the cancer diagnosis. The focus of the talk tonight will be on complementary therapy and how you can add or integrate these type of healing techniques into what I call complete cancer care. And how I define complete cancer care is the best of what the conventional system has to offer than everything else that you can do to empower yourself. So it's an integrated system. I have been studying this topic of complementary therapy for the last 10 or 12 years. And the first thing I want to assure you is that you have everything here in Nova Scotia that can provide you with the best chance of being cured and living well with your cancer. So there's nothing else that's magical out there. And I wouldn't have made that statement 10 or 12 years ago when I was first into this, because the scientific and medical communities simply didn't study complementary therapies very effectively. But in the last 5 to 8 years, there are major hospitals, world-class cancer centers who've dedicated whole departments to the study of complementary therapy. And so whether it's herbals right up to meditation, they look at those techniques in the same way that they would introduce a new experimental chemotherapy into their system. And so what happens is they scan everything for possible efficacy and then start to see what techniques and therapies could actually make a difference, and slowly bring those into clinical trials until now we have large randomized trials looking at these therapies. So we now know, so it's very good scientific information. And the first thing is that the experts are saying is that there's no cure-all, there's no magic bullet that works for absolutely everybody. Now, as an individual, you might find something that's exactly right for you, but there's no magic bullet, first of all. What the experts do say, though, is that there are many, many ways that you can empower yourself, many ways that you can improve your quality of life, many ways that you can make a real difference in your outcome and in your ability to get through the treatments. And so that's what I'm trying to endorse, is that you can make a difference. You can affect your health in a very proactive and very clear way and give yourself the best chance of recovery from cancer. And so I just want to repeat again, we're trying to endorse the best of the conventional system, and then you complement or integrate in those other aspects of care. You're empowering yourself at the level of the body, mind, and spirit. So that slide is just an overview of what I hope to accomplish in today's lecture and provide you a very clear approach to complementary medicine. The take-home points, though, is this. Use a balance between your rational mind, your reasoning abilities, and then following your intuition, that golden wisdom that each of us possesses. You want to do both of those things as you move forward in life. Tell your physician what you're doing, especially if you're going to take anything by mouth or occasionally by IV. You want to tell your cancer doctors so that there won't be an interaction with the recommended therapies. My talk is not going to concentrate on the biologicals, the oral medication. I'm going to talk about essentially everything else, because there's a second lecture that's going to talk about the oral aspect of it. And lastly, I just say don't forego the proven treatments if there is something out there for you. So some definition. Complementary and alternative medicine is CAM for short. It covers many philosophies and approaches and therapies. These are practices and treatments that haven't typically been taught in medical school, though that's certainly changing. There's a much more fuzzy picture with time. CAM as a whole is much more holistic, though. It really includes physical, mental, emotional, spiritual aspects of care, more so than the conventional medicine provides currently. This slide is actually a take-home slide as well. I'm not endorsing alternative medicine. So alternative medicine is used in place of standard medical treatments. So an example would be to be on some type of macrobiotic diet or something like that instead of what the cancer doctor recommends. And by definition, the alternative therapies have not been scientifically proven to be effective, and sometimes there's actually data to say that it actually worsens the situation. And they can be invasive, biologically active, and costly, so I'm not endorsing alternatives. What I am endorsing is this idea of integrated medicine, and that is, it's a total approach to care, body, mind, and spirit, and it combines the best of the medical system with the CAM practices that show most most promise, I should say. And so, for instance, somebody who's going through radiotherapy and is stressed could use a relaxation technique to decrease their stress and get themselves through the treatment. And so that's what I'm endorsing, is what I call complete cancer care. And this is a slide from Inspire Health. If you can look at the T of the tumor there, you can see surgery and chemotherapy and radiation focusing at a physical level on the tumor. But there's a whole aspect that the self can also influence the tumor, and we can empower that self in so many different realms. And so we need to tap into those techniques that work best for us. So that's the integrated healing model. And lastly, I want you to just realize that we're so very different in how we approach our circumstances. So there's no best way to approach a cancer diagnosis. We're unique, and that different strategies work at different times for different personalities. And again, it's that balance between the rational mind and listening to your gut to say, yes, this is right for me. This is helpful. I know this is going to work, or I'm on the right path here. Your strategy will change with time, though. That's definitely a given. Different needs occur at different stages in the cancer journey. So just as an overview of complete cancer care, the first thing is to understand what's happening from a very physical perspective, what the system offers, and then you can actually advocate for yourself to get the best from the medical system. And then integrating around that is these very effective health habits have a tremendous influence in the health. If I could just emphasize that line, exercise, diet, sleep, relaxation techniques. Those are key fundamentals before you start delving into the experimental. A positive attitude, psychosocial support, those other aspects are very powerful methods of engaging the mind-body connection. And then you can also consider integrating in the other complementary therapies that I haven't mentioned in this slide. So just to take one step back, conventional medicine unfortunately focuses 98% of its energies on providing physical care, chemo, radiation, surgery. It relies on scientific proof, and with that there's a documentation of toxicity, so your physicians can say, if you do this treatment, this is the possibility of these particular side effects. You can see your physician as a therapist, i.e. someone who can really guide you through the process and literally deliver the treatments for you, or you can see them as an information consultant. In any case, however you view your physicians, you want to understand what's the risk and what's the benefit of any option, including the option of not taking specific treatments. And because of conventional medicine, we have higher cure rates, for instance, in breast cancer now. But there's much more to the medical system than simply providing physical care. And there's a whole number of services you may not even be aware of that are out there that you need to tap into. You need to understand the beast that is the medical system so that you can get to the expert, whether it's the information expert, the exercise expert, the psychological expert. You need to tap into that system. And that's where there's kind of this blurring between what's complementary and what's conventional system there. Now, I like this picture because, whoa, is that are those in my pills? Is that the side effects I could have from these pills? I like this picture because he has to be proactive in his own health care. He has to know what he's taking. He can't rely on everybody else to do it for him. And that's the limitation of conventional medicine. There are financial constraints. There's a lack of holistic approach. Often people are kind of cut loose. Here's your treatment, and then you've got to kind of figure it out for yourself. And the fact of the matter is that conventional medicine doesn't have a full understanding. There's more to life than meets the eye. So we have to kind of keep ourselves open to the possibility of miracle. Okay, I want to take a step back again and say, let's look at cancer from a physical perspective and see how complementary medicine can fit into that picture. So in the diagram here, our scientific understanding is that the cancer starts as a normal cell that undergoes dozens and dozens of changes. Some of those changes are caused by some sort of damage to the cell within the bloodstream, for instance. Eventually, the cells get so abnormal that they turn into cancer cells and start to grow and so on. And what I'm trying to point you towards is maybe we can have an influence on the damage aspect and decrease the probability of further mutations in those cancer cells. So cancer is a physical problem. So it starts with mistakes in the words and sentences that tell our cells what to do. And these mistakes can be caused by oxidants, which are the chemicals in our bloodstreams that are highly reactive, can actually cause damage to our cells. And so, for instance, a healthy diet has antioxidants that can kind of mop up those damaging chemicals there. So that's the first thing, is you want to kind of mop up the further damage that's happening. And then in the big picture, you want to change the soup. The soup is the medium in which the cells were able to grow. So you want to change that soup by either your healthy lifestyles, exercise, nutrition, weight, good night's sleep, etc., or through the mind-body connection and all the techniques you can do to influence the chemistry within your body. So change the soup. And through that, as you relax and really start to take care of yourself, then your immune system can work much better to be able to, for instance, identify the cancer cells as foreign and actually eliminate or neutralize those cells. I'll quote a quick study here. This is by Dr. Dean Ornish in California. He took 93 men with prostate cancer that had been biopsied, but all the men decided that their cancers were slow growing and they weren't going to have the radiation or the surgery right away. And so they were not going to do anything other than go on this trial, where half of them were going to be on the experimental arm, which I call the full meal deal here, which is stress management, a low-fat diet with antioxidants, moderate exercise, and they have to go to a support group once per week. So they're really taking care of themselves in a really holistic sort of way. And the PSA, which is a blood test which measures how much cancer, how much prostate cancer there is, was measured at the baseline at the start of the study, then every 3 months for a year. And what they showed was, in the experimental arm, the guys that were taking care of themselves, none of them had to have their surgery or radiation. And in fact, the PSA blood test went down by 4% over that year. Whereas in the control arm, the guys that really weren't doing much for themselves, the PSA on average went up 6%, and 6 out of the 43 actually had to have surgery. And there was a scientific difference between those two sides. And it wasn't just the change in diet, because the control group kind of cheated a bit and were taking the diet 75% as well as the experimental group, and yet their PSA continued to rise. And they did a second experiment where they took the blood samples from both groups and tried to grow cancer cells, prostate cancer cells, in the blood samples. And those men that were following the full meal deal were able to suppress the cancer cells 70% of the time, whereas those who were just in the control group could only suppress the cells 9% of the time. So they literally were changing the soup through their activities. Those who were keen in their program, greater adherence, had a bigger benefit in terms of being able to suppress the cancer cells within the test tube. So I'm really trying to point you towards the very practical things you can do to empower yourself. So nutrition, extremely important. But you need to be smart about it. Obviously, we have different needs at different times. And if you have specific problems that I've listed here, then you want to see an expert, a nutritionist, to help guide your nutritional decisions. I thought when I first read this several years ago, I thought it was low-level science, but there's a lot of wisdom here in the balanced diet, because it's so complex how the micronutrients from a balanced diet can interact with cancer cells, for instance. And at minimum, you need 5 to 10 servings of fruits and vegetables, low in fat, high in fiber. The grandmothery type things actually make a lot of sense in this circumstance. The other one take-home point for you tonight is you should be taking vitamin D, certainly for the fall and winter months, because we don't get enough from the sun. There was a study in Nebraska of healthy women. Essentially, the women that were taking calcium and vitamin D over a 4-year period had 75% less chance of developing a new cancer than those who weren't taking their calcium and vitamin D. And we know from the biochemistry that vitamin D can actually suppress the cell cycle. So I think at minimum take that, a healthy diet. Beware of the extreme diets. Again, the science clearly shows that no one diet has been proven to control cancer. And the fact is, you do have a body that needs those nutrients to heal and to grow and to get better. If you're a strict vegetarian but with milk products, beware of your iron intake. If you're a vegan, then you have to be aware of these other micronutrients that are important. And putting those two together, looking at this very, very interesting study of women with postmenopausal women, or actually women with breast cancer, they had this large cohort of women. Their average age was 51. 95% of them had early stage disease. And they measured their exercise levels, their diet, their weight, their health every 6 months and followed them for years and years and years. And during that time, about 1/10 of the women died of breast cancer. And 90% continued to do well. And what they noted was that the women who were eating 5 or more servings of vegetables per day had less chance of dying of breast cancer. And the women that were walking 30 minutes 6 times per week had less chance of breast cancer. But there was a real effect if they did both of those together. And that was regardless of whether they were carrying too much weight or not. And unfortunately, only a small portion of the women are actually doing those two things, though. And this came out into what they call a survival curve. You'll look up top. The blue curve is the curve of the women that were doing both the exercise and a diet high in fruits and vegetables, where the other curves, they weren't doing both of those. So that's a way they can actually influence outcome, certainly in the breast cancer world. So again, if you're talking about complementary therapy, this is it. Exercise, exercise, exercise. A whole bunch of different trials showing that can really make a difference in your health, your strength, your well-being, your happiness. You want to aim for that 30 minutes, 5+ days per week. There are other healthy habits. These are the core, the fundamentals, the pillars. Maintaining a reasonable weight. There's lots of data that show that that puts people at risk of recurrent breast cancer in and of itself. Sleeping for 7 or 8 hours per night. Practicing a relaxation technique. Now again, this is starting to waver into classical complementary medicine, but this is super important in terms of changing the chemistry and empowering your body. So we need to learn to relax. We need to practice these techniques. We need to join the club or the gym or the teacher that can teach that, and then you practice it every day, and it incorporates those healthy chemicals right into your body and right into your life. And the fact is, a high percentage of people will be cured of their cancer and live for decades, and a lot of people who actually have cancer that weren't necessarily going to cure will live for many, many years. So your health is important outside of the cancer world. I endorse support groups as well. I mean, one of the great ways is you get to network with lots of people, and you get to share your emotions and bring those out into the light of consciousness. There's lots of reasons why you can empower yourself through support groups. So now I haven't really hit the complementary world yet, even though this is all, 20 years ago, support groups was definitely complementary. And now I can say that's standard of care. People should have that opportunity to follow that. So I'm talking about complementary therapy and how you combine it with conventional treatments. There. This is the classification of CAM, mind, body, biologicals, body-based, energy medicine, whole medicine. I'll explain each of these in turn. So the mind-body, the fact is the mind does affect the body. There's just no doubt about that. And so, for instance, I highly endorse a meditation practice. And essentially, it's focused breathing or repetition of words or phrases to quiet the mind. There's some amazing studies that show there's actually a change in the chemistry of the brain, change in how the neurons get set down by practicing a technique. And even after you practice it for a few months and stop, the brain has still changed months later. And I've learned recently it's just not that there are new connections set down, we actually grow new brain cells. And I wouldn't have said that a year ago. Your brain, like your muscles, continue to adapt to your circumstance. You can make a difference by practicing and integrating that into your life. Biofeedback. So for instance, people are set up, measure their blood pressure, their heart rate, and the patient learns how to affect their bodily functions. And some fascinating experiments about how people can change how quickly they clot their blood, or the level of the white cells in their blood, their blood sugar levels, all through these type of techniques. Hypnosis. Essentially, you need to get into a relaxed and focused state, and they concentrate on a certain feeling or idea. And for instance, we know that the placebo effect is real. The placebo effect, you think you're getting a morphine pill, but actually it's a sugar pill. And people's belief actually changes the chemicals in their brain. It's not that they're faking it. They're saying, oh, I'm not feeling pain. There's actually a chemical change in the brain that requires a second medication to reverse. And that happens in 30% of people. And there are lots of other studies, mock ultrasounds to decrease swelling after wisdom teeth extraction. Again, people actually influencing their inflammatory process according to what they believe. It's a powerful, powerful effect. Yoga, system of stretches and poses. I can't capture all of yoga in a single slide. What I can say, though, that there was a randomized trial for women in the Bronx. This is, inner city New York. Half the women on yoga, half the women who weren't. It was all breast cancer patients. The women who were doing the yoga had better relationships afterwards. They were happier. They had higher self-esteem. They had better energy. These things really influence the quality of their life. There's imagery, there's creative outlets, all sorts of different ways to tap into the physiology of joy, the physiology of feeling happy and blissful. You can actually change the chemistry in the same way that there's a physiology of stress. So the Society of Integrative Medicine, which is made up of physicians, made this recommendation. So they basically said the mind-body modalities are recommended as part of multidisciplinary approach to reduce anxiety, mood disturbance, and chronic pain, and improve quality of life. So they clearly recognize the science actually makes people feel better and better able to cope on their journey. There's the biological. So this is number 2. So things found in nature, supplements and herbals, vitamins, et cetera, et cetera. I'm not touching on this one because that's really the focus of the next lecture. The bottom line is, and I ran into a patient recently, basically said, I was too scared to tell my chemotherapy doctor what I was taking. And I worry about that situation because there can be interactions between the herbs and the therapies. And this is it. The natural product does not mean a safe product. Dietary supplements such as herbs and vitamins may affect how the other medicines affect the body. So for instance, the St. John's wort, taken for depression, for instance, may cause certain anti-cancer drugs not to work as well. Another one is kava, taken for other reasons, can cause liver damage, can influence the therapy. Too much of anything is not a good thing. So for instance, too much of a vitamin cannot be safe. An example would be high-dose vitamin C seems to interfere with chemotherapy or radiation. You're blocking the avenue of the conventional treatment. The next is the manipulative or body-based practices. So basically working with the body, which is connected with the mind and the spirit, obviously. So massage, the data is quite clear that massage helps people with feeling anxious. It definitely helps people with pain. But you'd want to see a very good practitioner, because there are certain circumstances like massage over a tumor site or massage when there's buildup of fluid in the arm called lymphedema. You wouldn't want to do those things unless there was great expertise there. So chiropractic is a certain type of manipulation of joints in the skeletal system. Reflexology, essentially using pressure points in the hands or the feet to affect the physiology of the system there. The next one is energy medicine. So energy medicine involves the belief that the body has certain energy fields that can be used for healing and wellness. And the therapist either put some type of pressure there, put their hands through these fields to influence health. And so I've actually gone through several courses of healing touch and Reiki and therapeutic touch and so on. And as a scientist, I can say, I don't understand how this works. I just can say that I've had this experience. I've been able to sense in different people's bodies, some almost like feeling like a magnet in a certain part of the body, or those type of things. The bottom line is we don't understand everything. I'm not saying that this is going to cure cancer, but I can say that I've seen people go from very stressed to being very peaceful through a very simple and safe technique. So there's more to life than meets the eye. And miracles do happen. So Tai Chi is a real overlap between energy medicine and Chinese medicine and the mind-body connection, for instance. But essentially it's like moving, slow, gentle movements with a focus on the breath. There's the idea of Qi, which is life energy that can flow as you practice these techniques. Reiki, I told you about a little bit, a sense balancing the energy by putting the hands away from the body. Therapeutic touch is the same idea. It's all part of energy medicine. What the experts have said through the scientific studies is that it's safe, but they can't be encouraged due to limited evidence of efficacy. So we can't say it's actually influencing cancer cells. People definitely feel better through this. And then there's a whole other system of complementary therapy, and from different cultures throughout the world. So there's Ayurvedic medicine based in India, emphasizing that balance between body, mind, and spirit. There's a whole system of Chinese medicine, 5,000+ years old, where in a sense we want to create a balance of the two forces of yin and yang. I know these are gross oversimplifications, but just to give you a feel for some of the language. Acupuncture, this actually has been studied very closely. So it's a common practice in Chinese medicine that involves stimulating or putting pressure on certain points within the body, and this promotes health. And there's a whole number of randomized trials that actually show that acupuncture actually changes the neurochemistry in your brain, changes the neurological system and the outputs and so on. So it's probably having its mediation through the nervous system. And it is recommended in people whose pain is poorly controlled. I have somebody who's having nausea on radiotherapy, who I'm going to refer to acupuncturists for treatment of the nausea. There's a number of other symptoms where acupuncture can help with these symptoms. So very, very well studied, more scientific fashion. Just to give you some quick other subtypes, homeopathy, essentially using a little bit of medication diluted into smaller and smaller amounts of a fluid until there's hardly any medication in the fluid, and then the patient takes that amount of substance. Osteopathy is basically a manipulation of the skeletal system and the muscles and trying to restore health. Naturopathic medicine uses different medicines to heal the body naturally. And so I chatted with a naturopath several years ago, and they say things that seem quite reasonable. So it's this idea of emphasis of strengthening the body's ability to fight off cancer. They would say something like cancer forms as a result of the body's inability to heal itself, so we want to strengthen the immune system. They consider toxins and lack of sleep and exercise and so on. It's a more holistic view. So it really, and I guess the issue is when they're prescribing herbs and vitamins, that's where it can interact. But overall, this is, really sounds like clear, good, wise suggestions. And what the scientists said, they're on the conservative side of things, is basically that it's hard to recommend the dietary supplements and herbal products unless they're really evaluated for their full side effects and potential interactions. And so they don't recommend it if a person is on chemotherapy or radiation or just prior to surgery. So that's the big overview of what CAM offers. And the fact is, just outside of the conventional treatment, a lot of people, as Teresa Marie was saying, are taking CAM at any one point in time. 70% of cancer patients this year will take it. And it's a very, very large industry. And a lot of people are taking herbals and mega vitamins. One of the great advantages of CAM is that the practitioner often gives you more time and attention, and there's a greater focus on the emotional and spiritual aspects of the journey. The patients are involved very much in the process. Sometimes just having that massage or the touch is very, very healing in itself, and it can provide people with hope. So lots of reasons why people can connect with a practitioner. And I also say as an aside, in terms of choosing these things, sometimes it's the therapy, the choice of the medication or the technique. Sometimes it's the practitioner, you connect with that person, and sometimes it's just the relationship of all those three together that puts you into that space. So there are lots of reasons why you can connect with a CAM practitioner and have a very good experience. The disadvantages are, though, that it can be expensive, and that some practitioners make false or unproven claims. Some of the toxicities are unknown, although that's a lot less frequent now because this has now been studied fairly scientifically, and there's a whole compendium of side effects, how these different medications interact with the conventional treatments. And I'll give you that website at the end. But obviously we want to be aware of the extreme diets and how that can influence your health negatively. So what should you do? Now that you kind of have all this information, just step back again. If you're going to buy a new car, how would you buy the new car? I'm just going to buy a purple car? Is that how it goes? No. You think, what are the pros and cons? What's the research? How can this car help me? What are the pros and benefits of all these decisions? And you use that information, and that can direct your intuition towards what is best for you. So in terms of the CAM world, you have to ask yourself the question, does the therapy work? And what's the quality of the proof that actually is going to make a difference in your life? So how you choose your CAM practitioner. First of all, you want to get somebody who's been trained properly, and you want to choose them carefully. So you can go to the organizations. For instance, there'd be a naturopathic organization within Canada and within Nova Scotia, and try to get the names of certified people if you want to go that route. You can contact the local health or wellness organizations, get their experience, right? You network with people. You ask each practitioner their training and experience. I'm going to take you through some of the questions that I would want you to ask that person. And ask them if they have a license to practice in the province, right? Because anybody can hang up the shingle, but you want someone who's trained and has experience. So what to ask them? How can it help me? How long do I have to take this? And essentially it's the same question that you'd be asking your medical doctor. What's the benefit? Are there studies that show this actually makes a difference? Show me those studies. What's the risk? What's the toxicity? Does it interact? And what's the total cost? You need all that information to make a rational decision. And in terms of quality of evidence, so you go from the highest level evidence, which is called a randomized trial, where half the people are treated one way, half the people are treated another way. Oftentimes the people who are in these studies don't know that they're on a certain treatment. And then you compare the results on the two sides. That's the best level science. You want to ask your CAM practitioner, are there randomized trials? And the next level down is comparison groups. We treated a whole bunch of people this way, we treated a whole bunch of people this way, comparing the two centers, case series, case reports. And the bottom line is, you know, I treated a few people, they seem to do well. Well, that's not even published. So look at the quality of the evidence being provided. Buyer beware. Beware of products that are advertised by people or companies that make claims that they have a cure, because there's no cure-all, although for an individual they may do very well with any treatment. Beware if they do not give specific information about how their product actually works. Make claims about positive results with few side effects. If it just sounds too good, I think that's a red flag as well. And say that they have clinical trials, but they don't have proof or copies of the studies. So then how do you find out more? I mean, this is just a sampling of the technique to get you going forward. So I've drawn on this particular website, which is the National Center for Complementary and Alternative Medicine. And that's you know, very good nationally funded center. There's the MD Anderson Hospital, which I refer to in my introduction. So they perform lots of different trials. There's another large center in New York. The website's there. There's the Naturopathic Compendium. So that's look at the different interactions between the medications. And I'd also advise you to go into Quackwatch. If you hear or see something that doesn't sound right, go there, see what other people are writing about it. It's organized by a medical doctor. And the Canadian Cancer Society offers an information service, essentially a free information service. You can call them and they can send you a package. And they have information from a huge standardized database on a lot of these medications. And again, you want to go to that information expert first there. Inspire Health is really a world-class Vancouver-based integrative cancer center. One of the things they provide is a newsletter that they send me every month, send a whole bunch of people every month, which is the best updates in all of complementary medicine. So they look at all the studies and all the literature throughout the world, and they publish this once per month. So they get the best updates in terms of what's becoming available there. Does CAM work? It certainly can for the individual. It definitely improves overall quality of life and pain and nausea and specific symptoms. There's always hope. So no matter what anybody says to you, you're not a statistic, you're a person. You can always do much, much better than the average there. And sometimes you can just find that route that's just right for you, that keeps you going and well, and as I say, miracles do happen. I'll leave you with this study. So this is by Alistair Cunningham, who runs the Healing Journey program in Toronto. And the title is Fighting for Life, a qualitative analysis of the process of psychotherapy-assisted self-help in patients with metastatic cancer. Whew. You can say that sentence, then you can join the club. They basically took 22 people who had metastatic cancer, so cancer spread to other parts in the body, and they followed them for a year. and they had weekly support groups. At the start of the year, all of them had an estimated prediction of survival of about 1 year. And they looked at their homework from the first couple of weeks and their involvement in the support groups. And they classified the participants into 3 categories. Those that had high involvement in their self-help, so they were doing a lot of things to help themselves, those who were low and didn't do much to help themselves, and those that were in the middle. And then they found that they had classified 9 of them as being highly involved, meaning that every day they were doing things to help themselves. They were practicing a meditation technique, they were journaling, they were chatting with their friends, they were doing things proactively in their time. And of the 9 highly involved people, and everyone had an estimated survival of a year, all but 1 of them lived for 2 years. Their quality of life was much better. 2 of these, I think they're both women actually, are out beyond 10 years now with no evidence of the cancer coming back. And these are women that the medical system said were going to die of their cancer. And of the 8 low involvement, they had low self-esteem overall, they had worse quality of life, and only 1 was alive at the end of the 2 years. And this is in graphical form. On the left side of the diagram is their estimated survival in the low, medium, and high groups. And then their actual average survival is on the right side according to their involvement. So those that were highly involved in their treatment had a much better chance of being alive and well later on. So you can make a difference. And the fact that you're here and listening to this lecture, I think sends a tremendous message to your body and your spirit about health and wholeness. And I think it can really help you in the long term. So in summary, we want to balance our approach in life. We use our research, our reasoning on the one hand, and then we listen to our heart and our intuition and our spirit on the other hand, and that can help guide us through the process. Tell your physician what you're doing, and ultimately I think the goal is the process. The process is to find peace with what you're doing now and get yourself in that space of healing and wholeness, and allow the physical body to follow that determination and that peacefulness in your mind. So I'll end the lecture there, and I understand that we'll be taking questions via email afterwards. But before I go, I just want to say that there is a weekend retreat coming up November 28th to 30th. I'm there with my very good friend and a very talented psychotherapist, Tim Walker, here. So essentially it's a weekend retreat. You can learn the coping skills and meditation and really empower yourself. If you want more information, the contact information is there. And it's free. So thank you very much for your attention, everybody, and to all the distant sites throughout Nova Scotia.